Good evening, folks. This is Dr. Paul. Thank you very much for tuning to our channel this evening. This evening, I want to talk a few minutes about Erythema Nodosum, a very common problem. So please put some time into this. Erythema nodosum, many times it happens as a red nodules on the anterior surface of legs. Basically, it is the most common form of paniclitis. It forms as red nodules on the anterior lower legs. So it's a paniclitis. Now, what is paniclitis? Paniclitis is basically inflammatory process in fat. So paniclitis is inflammation that occurs in the fat. Here, in the subcutaneous fat, there is inflammation going on. That's what forms these nodules. So erythema nodosum has it has this in terms of sex ratio, it is more common in women than in men. It's like a 3:1 in women to men. So it's basically paniclitis, and the lesions, they come with fever and other symptoms like arthralgias. So fever, arthralgias, and then nodules. That's the usual picture you get in this disease, and they may last for a few weeks. Now, epidemiology, it's a common condition, and today we don't have much data on the prevalence, but women are more susceptible to its development, and the female to male ratio is 3:1. Remember that. In boys and girls, it's same. It's equally spread in boys and girls. But when they become adults, there is a female to male ratio like 3:1. That's an important point, folks. Now, what is happening here? It's a inflammatory process. It can happen in four different ways. It could be a result of infection, inflammation. It could be a result of medication or hormones. So infection, streptococcal pharyngitis can give this. Medications like sulfonamides or estrogen-containing oral contraceptives can cause. Infection or inflammations like inflammatory bowel disease, sarcoidosis can cause this. So remember those causes: streptococcal pharyngitis, oral contraceptives, inflammatory bowel disease, sarcoidosis. The classic question comes like a woman taking oral contraceptives develops some nodules on the anterior surface of legs. What is this? Erythema nodosum. So the inflammation here could be either septal or lobular. So the paniclitis, the fat inflammation, septal or lobular. It's called septal paniclitis or lobular paniclitis. Basically, septa are fibrous divisions within the fat compartments. So in septal paniclitis, there will be septa like traversing all these fatty area in the subcutaneous areas, and the fat compartments are divided by these septa with neurovascular bundles going around. Then the lobular paniclitis is like lobes. So septal paniclitis, lobular paniclitis. You will see have lymphocytes, histiocytes, granulocytes, neutrophils, eosinophils. All of these will form in those lobules, and then we call it lobular paniclitis. So in erythema nodosum, we have two types of paniclitis: septal paniclitis, lobular paniclitis. Repeating this because histopathology is what you need to remember. So subcutaneous septa are forming. Commonly, there is fat necrosis. Remember, this is happening in the fat. Why is this happening only in the fat? Nobody knows. Nobody knows the mechanism, just the fat. But these macrophages eating away and causing the fat necrosis is happening in this disease. Now, let us see the hypothesis. The hypothesis is the body is having delayed type hypersensitivity reaction. So the hypothesis regarding the mechanism of development of erythema nodosum is a delayed type hypersensitivity reaction occurring in the septal fat. Immune complex deposition has not been found in these lesions. And if it is delayed type hypersensitivity reaction, why is this happening only in the fat cells? As I said, nobody has a clue. So these are the manifestations, and it comes as tender, deep red or brown nodules. And as the lesions age, they evolve like a bruise. And patients actually come and say, I have a patient this morning who came and said she got all these bruises on her thighs. So it can come on thighs, extensor forearms, and sometimes on the trunk. And the lesions, they represent a hypersensitivity response to infiltrating stimulus. They may present on, they may go away, but the stimulus could be anything. As I said, inflammation, infection, medication, hormones. These four. Patient could have a streptococcal infection and then develop these nodules. So streptococcal pharyngitis is a risk factor for this problem. Erythema nodosum may also be a sign of sarcoidosis. You see, everything falls under those four things. Inflammation, you can say sarcoidosis. Then infection, you can think of streptococcal pharyngitis. Hormones, you can think of estrogens. Medications, you see estrogen containing oral contraceptives. Then sulfur containing medications. So those are the four things that can cause erythema nodosum, a very, very common question. So please remember this, and because you will definitely see these people with this problem. And I'm telling you, you always see these people. Because I saw one of the patients this morning, and the patient has these classic nodules in the anterior surface of thighs and legs. She is taking birth control pills. So you can say this is erythema nodosum. So that's about erythema nodosum. Please visit our website www.drpaul.org for more videos. Thank you very much. Have a nice day.